Good morning, everybody, and thanks for being with us on KXAN Live. I'm Will Dupree, coming to you from the KXAN Live studio on this pretty warm Monday morning here in the capital city. A lot of you at home are clicking onto this one web story that we just published on our website not too long ago at KXAN.com. The headline reads, "Unwanted expired COVID-19 tests mailed to Central Texans, Medicare billed for them." The reporter behind this story is Arzo Dos, and we are very fortunate to have her joining us here this morning to talk more about this story and explain a little bit more behind the reporting there. So Arzo, thank you for joining us. We really do appreciate it.
Hi, Will. Thanks so much for having me.
You know, we just showed that headline there, and I want to just get everybody started and figure out how you got down this path and looking into this story. So talk about how you started looking into this.
Well, our team, our investigative team started getting some emails about Central Texans who were receiving COVID-19 tests in the mail. They never requested them, they never ordered them, they never wanted them, and they were puzzled why they were receiving them. And they were starting to get them by the dozens. So our producer, David Brera, and I started looking into the emails that were coming in. We asked to see the tests that they were getting mailed. We wanted to see what else they were getting. And they told us what was really alarming in the emails that we received was that they were noticing not only the test, but also their Medicare was being charged for the test. In some cases, Medicare was being charged $200, and it would end up paying, the agency ended up paying about $94 for a box of tests. So they thought it was alarming because, again, they had never ordered or wanted the test. So they wanted to know what was going on. And keep in mind, the people that we talked to are Central Texans. They had called Medicare, they had called the labs and warehouses, mailing them these tests, trying to understand what's going on. Should I use these tests? Some have arrived in the mail that are expired. What do I do with these? And they were having a really hard time connecting with anyone. And so that's when they connected to us, with us for answers.
One of the concerns that they share with you, though, is that not only are they getting these tests, but also that there is a cost to taxpayers.
And that's the biggest thing. The several people that we connected with said, look, this isn't costing me anything, but it's costing taxpayers because Medicare is paying for this. And the organization that runs Medicare, the Center for Medicare and Medicaid Services, tells us, yes, there was a point where over-the-counter tests were being given to people with Medicare, but only if requested. That was a stipulation. And in all the cases that we've looked into, these tests were never requested or wanted.
The people you spoke with had trouble getting in touch with Medicare, as you mentioned. What did the Centers for Medicaid and Medicare Services say to you whenever you reached out to them about what these Central Texans were talking about?
Well, a spokesperson tells us that they have heard from people who have Medicare, who have received these tests, but it's a small amount of people. And we have asked for that data, but as of this report, we have not gotten it yet. And, CMS says that they are looking into these concerns because fraud is a concern for them. And they've got safeguards in place. But again, the biggest thing is that if you got these tests and you didn't request them, that should be a red flag and you should contact CMS. CMS also says that it's been working with law enforcement agencies to investigate these cases. So your calls are making a difference because they are looking into these cases. For instance, in April, there was an indictment in Florida where 2 people were indicted for allegedly buying Medicare identification numbers and then selling over-the-counter, COVID tests to them.
That was my next question for you, is what kinds of investigations are happening into this because of people receiving tests like these situations that you highlighted in your story?
Well, the Department of Justice calls it first of their kind charges when they charged the 2 people from Florida for something like this. And what we know from the CMS spokesperson is that they are investigating these cases because they want to know what's happening, especially with the expired tests. They said, even if you're getting expired tests, you should call Medicare and let them know because that can also be an instance of potential fraud.
Were the people that you talked to in your story concerned about their own information possibly being compromised because they are also receiving these tests.
Absolutely. Everyone we have talked to, and since we've published the story, we keep hearing from more Central Texans and Texans impacted. They tell us that they feel like their identity was stolen. Essentially, it may not be a credit card, it may not be their check, because they feel like they're being charged in Medicare in some cases, and then even their insurance companies being billed for something that they didn't want to have anything to do with.
A few moments ago, you did mention that someone maybe share some advice for people if they get one of these unwanted tests. Perhaps they know someone who did as well, and also heard the information about Medicare being billed for them too. What should they do in that instance?
Well, I want to make sure that we send our viewers to our webpage on this story, because we've got a section that's got phone numbers and online links where you could easily click on and it would take you to where you could report this. But essentially, if you are getting COVID-19 tests that you did not want, you did not order, or you did not request, you need to report it to Medicare. You can call 1-800-MEDICARE. If you go to the story, there's a bunch of resources available for you. But also, if you've gotten expired tests, make sure that you're looking at the box to see if they're expired or not. The FDA did extend some of the expiration dates, but still, if you're receiving expired tests, which in many cases our Central Texans have been, then you need to be reporting those as well. If it's hard to get through Medicare, please get in touch with me, and I will figure out a way to get your contact information to them.
The people you spoke to in the story, have you heard from them since the story was published about if they've received any additional help because of what you shed light on?
Well, they have been reporting every shipment that they've been receiving.
Wow.
So in the cases we profiled, one family got more than 50 boxes of COVID-19 tests they didn't want. Another family, very similar situation, except many of theirs was expired. So when we started hearing from the Central Texans, we asked them, hang on to the tests. We want to see where they're coming from. My producer, David Breyer, and we started calling the labs and warehouses, sending Central Texans these tests, get a better understanding of why did you send them to these folks and when they didn't request them. But we have not heard back yet. And so it's important that, you do make the time to call, because that will officially start an investigation. They will give you a number, and that will kind of able you to keep track of where the investigation is going.
And of course, if we hear anything back, you all will be updating your story and our coverage on our website, KXAN.com. Arzo, is there anything that you would want to add that we didn't get a chance to talk about? You've answered a lot of the questions I had and then some.
Well, no, I think this is really helpful because, we're dealing with our community that sometimes, when you get these things, that looks very legitimate. So you think that, nothing is wrong. But in these cases, red flags were raised. So another key point is look at your Medicare statement, see what you're being charged for. In this case, it was COVID-19 tests, but in another situation, it may be something else. And so unless you've asked for that, you've been treated for it, then you should not be getting billed for anything that you didn't request.
Covering very important topics in our community, as always. Investigator Arzo Dost, thank you so much for joining us this morning. We do appreciate it, and we appreciate your reporting too.
Thanks, Will.
All right, everybody, that is Arzo Dost, and you can check out her story. Again, the headline reads, Unwanted Expired COVID-19 Tests Mailed to Central Texans, Medicare Billed for Them. It's on our homepage right now on KXAN.com, so please check that out. And again, there's information there to help you if you or someone you know has received one of these unwanted expired COVID-19 tests. Once again, I'm Will Dupree in the KXAN Live Studio. Thank you all for watching here this morning. We will see you again at another time. Hope you all enjoy the rest of your day. Take care. Stay safe.